we have Reverend Dr. Q English. Reverend Dr. Q English serves as the director of the Center for Faith-Based and Neighborhood Partnerships at the U.S. Department of Health and Human Services, and she worked closely with the White House Office of Faith-Based and Neighborhood Partnerships. As a coalition builder and network strategist, Reverend Dr. Q English joins HHS from the state of New York, where she served as the Deputy Director of Faith-Based Initiatives for the Governor's Office of Faith and Community Development Services. Here, she identified opportunities to elevate strengths and identify new opportunities to build relationships with the faith-based community. She also conceptualized and was instrumental in forming the faith-based office and the office of the Mayor of New York City. She has brought together several roundtables and interfaith coalitions to create and implement strategic plans to tackle New York's most problematic issues. Reverend Dr. Q English is the founder and past president of Not On My Watch, Inc., an organization formed to combat human trafficking and domestic violence through education, training, and community and policy advocacy. She received her master and doctorate degrees from New York Theological Seminary, where she was the recipient of the Excellence in Ministry Award, the highest award given to a graduating doctoral student. I also just want to add, I have had the pleasure of attending a few health summits that HHS has put together that Dr. English was instrumental in pulling those together, and it has been an amazing, and this is where you become a nerd, an amazing demonstration of what government can do when it's doing it the right way and it's doing it from an informed way. And so from just an average American citizen taking off my Lauren Relaford hat, I'm grateful to know that we have people in some of the highest spaces of power that are actually infusing the work with humanity and doing it with such heart. So Reverend Dr. Q English, thank you so much.
Thank you. Wow, what an introduction. It's like, who is that person? Thank you, Lauren, and thank you, Dr. Doug, for your amazing opening. And I was just thinking, you know, when you were talking about bringing us to the table, it's because we're relational, not transactional. Mm-hmm. And I think that has to be at the forefront of our minds as we engage with the faith community. So the Center for Faith-Based and Neighborhood Partnerships, we're a federal office located in the Office of the Secretary and the United States Department of Health and Human Services. Our primary efforts of the center focus on strengthening the response of faith and community-based organizations to critical health and human service issues, from the opioid crisis to maternal health. So let's take a look at maternal health. So the key findings from the Centers for Disease Control and Prevention, CDC, show that non-Hispanic Black women are 3 times more likely than white women to die from a pregnancy-related cause. American Indian and Alaska Native women are 2 times more likely than white women to die of pregnancy-related causes. And we also know that there are 28 Hispanic maternal deaths per 100,000 U.S. live births in this nation. We have 25,000 women experiencing severe, unexpected health problems related to pregnancy that may have long-term health consequences every year. And as I read these stats to you, here is, I feel, the most heart-wrenching fact is that, according to the CDC, 80% of all pregnancy-related deaths are preventable. 80%. That's nationally. You can go into some cities and you will find that even those numbers are higher. New York, 9 times higher, you know. So these numbers vary by state. So maternal mortality and morbidity remain a major public health concern in the United States. The factors related to maternal vulnerability in this state include physical environment, mental health and substance abuse, socioeconomic determinants, physical health, general health care, reproductive health care. And you also need to know that suicide now is the leading cause of death of women postpartum, 6 to 12 months. And what has now become the new monster is our pregnant woman contracting syphilis. And so the numbers in infant mortality has pretty tripled in that one particular area. While Pfizer is working on increasing our penicillin, we are at a shortage, and so there's a lot of work to be done in this space. So the Partnership Center's efforts to address this critical public health crisis are grounded in the White House Blueprint for Addressing the Maternal Health Crisis, which imagines a future where every person in the United States can have a safe, dignified pregnancy and birth, where equitable access to health care before, during, and after pregnancy is a right and not a privilege. It's a right and not a privilege. And we understand that a lot of what's going on in our country today is rooted deeply in racism and healthcare disparities, which we cannot ignore. But so when I see this problem, particularly as a reverend doctor, I don't know about you, I always have that need to, we gotta do something. Because in my estimation, what pains the heart of God must also pain us. If it concerns him, indeed it should concern us. And the problems the problems that angers us are the problems we're assigned to solve. The problems that saddens us are the problems we're assigned to heal. That's a beautiful place where destiny and purpose kiss. Our Moms Tour, that's why we launched it. We call it the Moms Tour, Maternal Outcomes Matter Shower, because it was important to me that when I proposed this to HSS and the White House, which went through a rigorous clearing of process, I think many of you know how that worked, it was because we have to go to community. It wasn't enough for us to create these funding opportunities and making announcements via an amazing media advisory or press release, but we needed to go to community. Our Moms Tour this year plan to visit approximately 25 communities with high maternal mortality and morbidity rates, especially among Black and American Indian, Alaska Native population. And we're not only going to bring resources and needed supplies, but also connect moms and families to local mental health professionals. We're saying that suicide is one of the leading causes of death, then we need to connect them to these services. We're connecting them to birth workers. A lot of people don't even know what a doula is or what midwifery services look like, but the CZC has proven that those that have had these services fare better than those that did not. Medical professionals, we're connecting them to healthcare coverage, mental health services, support services, as I said, offered by doulas and midwives, vaccinations, what's good for the mom is good for the baby, health screenings, toolkit for postpartum depression, which we created on the federal level that many people don't know even exists. Thus, we have to go to community and more. In this way, we are strengthening families and their connections to local services. So last year was our pilot. We touched over 5,000 women, connected over 1,700 to mental health services, connected over 800 to midwifery and doula services, and in line with the Vice President's Maternal Health Blueprint, where she wanted to see the perinatal task workforce expanded with culturally competent individuals, we were able to see almost 200 African American certified as doulas last year. And this is why it works. It works because we show up. And that for me, I'm living life on purpose, right? Intentionally, that what I do is a call, not a profession. It's a call. And so the Moms Tour recognizes the experience of health disparities and seeks to meet and serve community members where they are with the information they need and connections to local services. We also have a dad's den. Why? Because it's not I'm pregnant, it's we're pregnant. And they suffer too. We think we have postpartum depression just in women. No, the fathers are suffering too. Even to the point now, we're seeing the growing population now of men becoming doulos. It's exciting. So again, it's an opportunity to galvanize and network local partners and federal, state, and regional assets, and it creates a positive environment for moms and families and celebrates this sacred moment in their lives. So we at Health and Human Services, we're going to continue this movement, this work, this call, this God-given purpose until the United States becomes one of the safest places for women to give birth. Thank you.